Hi everybody, it's Shannon and Michael here with Healthcare Genius, and we're here today to talk with employers about different ways that you can add value to your employees through employee benefits, but without breaking the bank. The first thing that we want to touch on is the importance and the value in telemedicine. Now, Michael, what exactly is telemedicine and how does it work?
Kind of works three ways. We're seeing texting over the phone or video chat with a physician when you have certain conditions that don't really require you having to go to an urgent care or to an emergency room. Example, my daughter a couple of years ago was away on vacation. She came down with pink eye. So she was able to call a doctor over the video. They looked at her eye. They said, yes, you definitely have an infection there. Prescribed medicine to a Walgreens that was close by. She was able to do that at basically no cost other than the cost of the prescription. So there was no cost for the actual telemedicine visit.
That's a great example of when telemedicine comes in handy, when it's pretty easy to tell what's wrong and you don't want to get up and go to the doctor. Another really big benefit that we see here is for people with children. When you have young children in the house, maybe they've had ear infections time and again, you know what's going on, or maybe you don't know what's going on and you don't want to pack up all the sick kids in the car and head to the doctor when you have another option. So this can be a really great benefit for employees, and it's at a pretty affordable cost.
Well, and from an employer perspective, how many of you have had the employee who comes into work, who's sick, gets everyone else sick, because they don't want to have to go to the doctor, or maybe they don't want to have to pay a copay to go to the doctor. So this is a way that they can get what they need from a medication treatment standpoint and not have to worry about, we said, having to pay a copay for the cost of that visit.
Absolutely. So number two thing that we want to talk about is all the different discount programs that are available that a lot of people don't know exist. And some of these discount programs can cover lots of things, from extra support for diabetics, whether it's diabetic supplies or support that goes along with that disease. Hearing aids is a big one. People are starting to get hearing aids younger and younger, so it's not just your employees that are on the verge of retiring that need these. And as we've talked about in some of our videos, hearing aids are not covered under health insurance or Medicare, and they are really expensive.
Yeah, actually, Shannon, I used it. I think we talked about in an earlier video. I used one of these discount programs for my mom, and it shaved about $1,500 off her hearing aids, which, was quite a bit of money when you looked at the cost of the hearing aids as a whole. It was a nice benefit.
There's also discount programs for vision and dental.
And interesting, Shannon, a lot of people, if they only go to the doctor, to the dentist a couple of times a year, and they don't mind using a restricted list of dentists or a much smaller list than what traditional dental plans have, these plans can work really well and save a lot of those premiums. We see dental premiums now for single people, $40, $45 a month, whereas these plans, oftentimes there's no cost to them. So if you're trying to figure out your budget and how to do things, then this is another option that you might want to take a look at for trying to save some money.
There are also programs that have discounts for different things like imaging. I know personally that MRIs can be extremely expensive. Even things that seem like they should be simple, like an ultrasound, the prices can really get up there. So these discount programs can really help offset some of those costs.
And especially if you have one of those high deductible health plans that we've talked about in some of our other videos, where you're paying that out-of-pocket cost, it's really important to make sure you get the best value. A lot of times your doctor may or may not know when they send you somewhere what the cost of those facilities are. So you want to make sure you do your own due diligence. And again, these plans can make a big difference in your pocketbook, giving you, hundreds, if not, and we've seen thousands of dollars of savings over going to a traditional hospital for an MRI. So
right. And unfortunately, that's not always your doctor's number one concern is your insurance. They're just focused on getting you healthy. Make sure you know where you're going. And if it's on the discount program list, it could really save you a lot of money. Chiropractic care is another one that not all insurance plans cover, but there are discount programs available. If you have employees that see chiropractors, it can be a huge part of their health, but it can be pretty costly. So definitely look into that if you have any employees that do see chiropractors regularly. And the last discount program that we want to touch on, which is arguably the most important, is prescription discount programs. There are a number of them out there. We all know prescriptions can be extremely expensive. Drug costs continue to rise, and these programs can really help employees deal with prescription costs.
As Shannon said, there's quite a few that are out there. There's one I think that's been advertising a lot on TV. Again, even if it's $20 or $30 off a prescription, that's a big deal if you're doing that monthly. We've seen people save $50 to $100 in some cases at no cost to you. So I think it's a great value.
Absolutely. The last thing that we want to touch on are what we call advocacy programs. And there are actually companies out there that if you're a member, and again, at a really low cost as an employer, you can offer this to your employees. Employees can go in, and if they have a question about which provider to see, where they can and cannot get imaging work done like MRIs or X-rays, if they have questions about what doctors they can see, and if they can't quite figure out insurance, because as we all know, it's really, really complicated and people oftentimes don't know how to utilize it in the best way, they can call this number and there are individuals who can help them and walk them through what exactly they should be doing. And this is not only a benefit to your employees, but as an employer, I'm sure, especially if you're contributing to their insurance plans and insurance premiums already, it's really important to teach your employees how to maximize the insurance that they do have. And these advocacy programs really help to do that.
They really are fantastic. And, a lot of times employees don't want to go to HR. The advocacy program gives them a third party who understands their benefits. So they have, the examples of all of your plans, but it kind of takes you and others out of that whole process that maybe an employee just doesn't want to share.
And stay tuned. We're actually going to create another video specifically about advocacy programs because we do think they add so much value. But that's just kind of an overview of different ways that you can help your employees. Of course, every group of people is different and has different needs, but these are some of the things that are extremely valuable, again, for a really low cost. If your benefit advisor can offer you some help on any of these things, great, but oftentimes they aren't really aware of some of the programs. So if you're interested, feel free to apply to become our client and we can talk about what maybe some of the best options are for you. Thanks for watching. Make sure you subscribe to our channel and click the notification bell so you know when we come out with new videos. And we've got lots of other content on, as an employer, what are the best ways to help your employees with healthcare and retirement. So make sure you check them out.